So we are talking about strengthening existing compliance programs. It's not just HIPAA, but that's one of the big ones for our client base. But there's many different compliance frameworks out there, and they're not all treated equally. Um, and one of the challenges that we run into is that some of our clients are lulled into a bit of a false sense of security because they know that they're held to a framework, but they don't really know much more details beyond that. So it might make them feel a bit more secure than they actually are. Are their audits actually making them safer, or is it simply checking boxes? We need to make sure that when we're providing a client with compliance capabilities, and when we're a client that's held to a compliance framework, that we're digging deep into some of these things. Even if we don't get into the technical level, if we're C-level folks, we need to have confidence that our folks are doing what they're supposed to be doing, and that we're putting in the real work. Because passing an audit and actually being secure are not exactly the same thing. So today we're going to talk about how to, mind how to meet in the middle on those things. So the folks that this is geared towards are going to be compliance focused organizations. You don't necessarily have to be held to a specific compliance requirement. There are some generic ones, such as the CIS top security controls. I think it's top 18 now instead of top 20, or the NIST, the National Institute of Standards and Technologies Cybersecurity Framework is another good one. But folks such as HIPAA covered entities, healthcare providers, doctors' offices, all those kinds of things. Lots of other regulated industries. If you're a public organization, then you might be held to Sarbanes-Oxley or SOX. You might be under the Graham-Leach-Bliley Act. You might be under FERPA. Probably we don't have anybody specifically in here held to the New York Department of Financial Services ones. But that's still a framework that some businesses are held to if they do business in New York. So perhaps SOC 2, PCI, DSS. Most of our clients are going to have at least one of these different ones. So, all right. And CMMC is a totally different conversation. I'm not sure if we have any CMMC folks in this webinar or not, but that's definitely a much deeper level of compliance, and definitely this meeting would be for you guys as well. So what do we keep seeing as we dive into doing compliance with our clients? The whole purpose of compliance is that we want to have a baseline, a floor. This is the minimum best practices. Doesn't necessarily mean we have to do every single thing in the compliance framework, but we have to have at least an informed and acceptable reason for why we're not doing the thing, or some sort of a compensating control, right? Something that achieves the same ultimate goal. But the reality is that the attackers don't care about baselines. They don't care about the floor that we're trying to set. They care about the ceiling we didn't build. So just blindly following a compliance framework, abstract from the actual needs and reality of the business, is going to leave gaps and potentially negatively impact your workflows even. So not only do we want to make sure that we're as secure as possible, we want to be as efficient as possible. And sometimes there's going to be reasons why we may not want to do some of the things in the compliance frameworks, and we have to understand the why, describe it here. So compliance status itself is not breach immunity. Just in the past, I think this was from, I want to say this was from 2025, there were 725 plus reportable HIPAA breaches, and those are just the ones that were actually reported. They're supposed to report all of them, but it doesn't mean they actually did. So we're aware of at least over 725. That's a lot. That is a lot. Some of them are small. Some of them are pretty big, though. 82% of them, when they did the deep dive into it, was that it led back to a known risk, something that they were actually aware of and hadn't resolved. The median dwell time, this number varies depending on the source that you get it from, but for healthcare organizations in particular, they're lagging quite a bit. Dwell time in overall enterprise is down now closer to 3 to 6 months, But still, the idea that an attacker has breached your environment and is living there, watching, waiting, gathering information, digging themselves in deeper for that much amount of time is pretty scary. And just following a compliance framework blindly is not necessarily protecting against that. All right. So compliance and security, they are absolutely related. They are, but it's not exactly the same. So some of the key differences here is from a cadence perspective, with compliance, typically you're looking at an annual sort of an audit or a report. It's a point in time, it's a data point, right? If you're looking at things from a security lens, we want to be looking at things continuously, pacing with real world threats, right? This is going to change constantly, whereas a compliance framework might not get updated for years at a time. But there's security bulletins and alerts coming out weekly, right? With compliance, the evidence that we have to provide is going to be things like a document that shows a policy. It's going to be an attestation from an individual. But the true security control here is making sure that we have actual data, the telemetry, and controls that we've actually tested to make sure that they work, right? It's not just a box we checked. We made sure that it's actually doing what it's supposed to be doing. When compliance has changes happening, it's the regulators, it's the auditors that usually push those changes. And they're doing it from real world data, ideally, hopefully. But from the security standpoint, that's not good enough. We need to make sure that we are looking at real world threats and incidents on a continuous basis as they happen. That's informing how we are handling cybersecurity for our organization. And with compliance, if we pass an audit, great, good. Then, a lot of businesses say, okay, our box is checked. We can move on. We can focus on other things, usually sales. And I get it. But from a security standpoint, we want to make sure that we have actually reduced our attack surface, actually reduced the threats to the business. So if there's a failure in compliance, well, it's on paper, right? Maybe there's a fine. HIPAA does have that wall of shame, right? But if there's an actual failure in security, it means we have an actual compromise, right? So there's a big differences here between compliance and security as concepts here. They do, yeah.
I got a question that I think that I would be wanting to ask if I was in the audience, but sometimes there are things in compliance that you want to have the lowest cost, lowest overhead. In other words, you just want to check the box because there is no measurable benefit to security. And some things you actually want to invest more because it can relate to actually being more secure. So how do you help our customers balance this as they go through it, and you let the small business check the box for the thing that just needs to be checked and off the plate, yet recommend where the real investment should take place?
Exactly, because you could spend half your budget on just one administrative control, one security control, and a compliance framework, right? You could spend all kinds of money on something, but if it doesn't actually move the needle. So we need the security team led by a CIO, VCISO, whoever it is, feeding information back and understanding where it's best to actually spend that time and attention. Yes, we still have to check the box, but if there's not much measurable risk in that particular control, then we can do something, fairly simple that achieves compliance, requirements, and then we can allocate those resources into another area that's going to be a lot more beneficial. You pretty much can't spend too much time or effort educating employees, so that's always an area that I want to make sure that we want to have good attention on if there's budget left over, right? Does that answer your question, Eric?
Yeah, perfect. That was exactly what wanted to clarify.
Awesome. Okay, so the HIPAA security rule, all in one slide, right? This is just to refresh people that might not be as familiar with it or want a really high level thing. In particular, there's three main categories of controls here. There's administrative, physical, and technical controls. So administrative controls usually require a risk assessment, right? So we understand what the risks to the business are. We're going to do some workforce training. That's always a good thing. We might do some tabletop exercises and plan out business continuity and incident response. That's all administrative sort of controls. From the facilities, from the physical side, we're talking about where the rubber hits the road, right? We want to make sure that we've got devices locked down so we don't accidentally allow people to plug in a USB drive that they picked up in the parking lot, right? That's how the Iranian nuclear reactors got destroyed, some years back. Was CIA had contractors drop thumb drives in the parking lot, and people plugged them in because, of course, human nature is to be curious, right? And who knows what's on those thumb drives? And when they plugged them in, a script automatically ran that told the refining centrifuge to spin at a higher revolution, a higher RPM than the device was designed to handle. And so they broke. Something as simple as that. Obviously, it required a lot of knowledge and planning, but it's a real world issue, 100%. We lock down workstation use. We want to make sure that we're locking down who can get into the building and different areas, things like that. Devices are containing PHI, so we want to make sure that they're being disposed of properly, of course. And then the technical safeguards, right? So access control, who can access what kinds of data? We're logging who is making changes or accessing that data, and we're encrypting it to make sure that nobody else can access it that can't possibly. So let's take a look at 5 different gaps that show up in just about every compliance program. Before I jump into this, just want to pause for a second and check and see if there's any other questions.
That's great, Ken.
Awesome. So these aren't your failing HIPAA gaps, for example. These are going to be your HIPAA program isn't doing what it should be doing for your security posture type of gaps. Different kind of a problem here. So first one is risk assessment as paperwork, right? This can't just be a task that's assigned to somebody. Oh my gosh, I got to get it done. I got to make sure these boxes are checked. We do the audit. We find the issues. They're identified, right? We find issues, and then it's just set aside. It doesn't have any ownership. So we have to make sure we assign an owner, right, to follow up and make sure that all the issues have the proper follow-up cadence and things are getting remediated once we understand that there's issues. And again, it's a point in time, right? So we want to make sure that we've got policies and procedures and tools in place. So just because we add a new system or a new vendor, we're not going to have to trigger a complete reassessment of everything. So doing our due diligence when we're onboarding vendors, for example. And oftentimes the report just goes into a folder and that's it. It's there in case somebody asks about it, right? So it has to be a living document, not just an annual deliverable. So an example, I worked with a small medical practice one time, and we did their initial assessment, found 14, 15 risks that needed to be addressed, documented all of them. About a year later, we came back to our annual review and asked, hey, who's been monitoring the risk register and working on it? And the answer was nobody. The register was a Word doc in a SharePoint folder, and multiple people had been told, hey, follow up on this. But because multiple people were treated as owners, nobody was an owner, right? Because everybody just assumed that somebody else was going to handle stuff. 3 of the original risks had actually blossomed into full-blown incidents in the interim, all of which could have been prevented if someone had been actively tracking it. These risks were known, but the tracking was performative. Now, sometimes we have.
Can you talk? Because when I work with customers, I think a lot of times people think that this has to be some big, mature, robust process. But the reality is, especially for smaller businesses, just having a spreadsheet that you review once a quarter and talking about them is what you might be talking about a spreadsheet with 10 or 15 entries. Just confirm we still know. I mean, you can do this in 15 or 20 minutes. And it's that discipline. So when you say lightweight, you're really talking about it can be pretty lightweight.
Like here on the slide, they mentioned I mentioned you could do a quarterly 30-minute review even, just to make sure, hey, are the departments actually working on this? Or maybe you're so small you don't really have multiple departments. You're a 20-person, 10-person doctor's office, right? If you're the doctor, you want to make sure that your folks are actually making these changes. Did we turn on multi-factor authentication for email? Did we make sure that our awesome MSP that we work with based out of San Luis Obispo and Fresno and Santa Barbara, has made the tweaks to the permissions on our workstation so we can't plug in USBs anymore. Stuff like that.
Yep.
Awesome.
And so it really comes down to a continuous improvement process, chip away, don't boil the ocean. That's what you're defining.
It can be overwhelming, right? If you have a big list of follow-ups, 10, 15, sometimes it might as well be 1,000, right? So having somebody sitting in a management seat, a CIO, CISO type person who can help prioritize, say, okay, yes, these are all risks. What do we focus on first? What's going to be the low-hanging fruit? What's going to have the most business impact? Typically I like to knock out the low-hanging fruit stuff. These are the ones that you can solve the issue, change a no to a yes in 15, 30 minutes, right? And that helps set a good pace. Like, hey, we're actually making changes. Things are happening. And then having the category of these are the really big ones, the urgent ones, right? Like no multi-factor authentication or something like that, or there's no offsite backup. Ones like that are absolutely critical. And so you got to make sure and prioritize, because sometimes organizations have the auditors give them the list and they're like, okay, well, you figure it out now. And that's fine if you've got somebody who's really actively managing it, right? Now, sometimes we have policies that don't match the practice, right? A policy is absolutely worthless unless people know about it, know how to use it, and it actually has some kind of teeth, right? It's got to have consequences of not being followed. Ideally, the policy has to be followed, right? We've got technical controls where, there's no way of not following it. But the reality is that that's not always the case. So an example of things that we see sometimes is, yes, we've got MFA everywhere, except they created an exception group because the CEO is too busy and doesn't want to be bothered when he's switching between phones to have to punch in his code once in a blue moon, something like that. And yes, we want to make sure that ownership and C-level folks are happy, but there are certain hard lines in the sand where we have to make sure that the policy is being completely followed by everyone. Same thing if we have a screen lock policy, right? Well, the receptionist doesn't like that when she goes on her lunch for 30 minutes and comes back, she has to log back into the workstation. So she gets an exception for it. But it's the exceptions that wind up causing the damage a lot of the time, right? We have to have encryption as part of pretty much every cybersecurity framework, but sometimes it's not always followed from a technical standpoint. We have to make sure that things have been changed from the defaults. Just because the devices support it doesn't mean it's been enabled. Just because it's enabled doesn't mean that it's actually required in the way that it operates, right? So there might be an exception process, but if nobody's actually reviewing the exceptions, sometimes they just get approved and get us into some deep water. Can't have that. So the fix for that is to run periodic policy to practice audits. Take a look at the policies we have and make sure, are they actually enforced? We got to do some QA there. Look for the exceptions, look for the gaps. And another example was we had a behavioral health practice, and it had an awesome 40-page security written information security plan. And there was a section specifically about automatic screen lock, and their particular compliance requirement was asking for 5 minutes of inactivity, which is fairly aggressive, but it's what they were being held to. So we tested 20 of the workstations, and it was only enabled on 7. So the other 13 workstations just got disabled by the users who were tired of re-authenticating. Nobody had ever checked. These are the kinds of things that, as an onboarding MSP, we often do a good job of checking, but they're the kind of things that don't always get caught on an ongoing basis unless you're specifically having somebody treating compliance as an ongoing process, right? So we're making sure the technology works, but there's a lot of small things where a user is supposed to have the ability to disable certain things, but if it takes them out of compliance and nobody's checking, that's a problem. We have to also make sure that the training that our folks have, which is one of the most critical things that we can possibly do, we have to make sure that the training is actually training the skills that we need them to have. I don't know about you guys, but I've had jobs before where I had to watch things like sexual harassment training. Um, I used to be a commissioner for the city of Ventura for 6+ years, so I had to do annual Brown Act training, and I'm literally watching the exact same webinar every year, and I'm not engaged. I'm really not, right? I know the stuff. I can take the test blind and pass it, right? So what's the point? It's just checking a box. We want to make sure that the training that your people are getting is engaging, it's role specific, right? So I don't necessarily need to be giving the same level of compliance or cybersecurity training to a clinician that I need to for someone who's sitting in a finance role or an IT role. It's going to be very, very different, right? And we can check that because we've got tools and systems in place that look at things like phishing rates or spam open rates. If nobody's paying attention to the open rates and they're staying the same or increasing, then clearly the training's not working. So we need to make sure that we're making some changes. So we can do things like run some lightweight phishing simulations as a project, and then make sure somebody is owning that project and watching. Hey, after we just did this training, did those rates go down? Do we have a group of people who are aggressive clickers? They click on everything. Oftentimes, sales and C-level folks tend to be a little aggressive on clickers. Eric, you're very technical, so I don't think you probably click on stuff too much. I haven't seen your know before report, but I'm
I'm batting 100.
There you go.
Yeah,
Awesome.
1,000. Yeah.
I've been caught by some before, especially when the guys get really aggressive with some of the fake phishing emails, and they cut.
I think the key here is if you think of like the Know Before campaign, it's a really good example. We can set up the campaign in a templatized way that matches general best practices, but without some level of involvement in the company and looking at the data and saying, well, how do we get click? How do we ensure people know to do the training? Are the people who are clicking getting trained? And what are the other things that might need to be optimized for their business? Maybe it has to go on the weekends because they have more weekend employees. Maybe email isn't as big of a thing. Without that feedback, your security awareness training is limited to the template's ability to work with your business, not optimized for how your business works. And
100%.
And those things can be aligned, and then you'll get a lot lower, a lot better results with those type of campaigns.
Yeah, well said. Well said. That's exactly the experience that we've seen out in the field. Another gap that we often come across is BAs get signed, business associate agreements, right? Then everybody moves on, and 6 months later, nobody remembers what risk the vendor posed in the first place, or even what they're supposed to be doing under the agreement. So what's the fix? We got to have a vendor inventory and classify risks according to those vendors, so we understand, do these vendors access PHI? Do they have any admin access? Do they have any access to our financial data? And then we're looking at it annually. It can't be just a one and done thing. Lower risk vendors, maybe you can push it off, right? Something like Microsoft, right? We understand pretty well, where they're at, right? But maybe the vendor that comes into, the office cleaning crew, or vendor we're using for, I don't know, our electronic health records system might change. So we have to make sure that the vendor inventory, the tools, and all the different compliance items that we need them to match actually does match our BAA file, right? Replaced vendors still have active agreements. We see that out there quite a bit, and that's not necessary, right? We want to make sure that the risk is being tiered, right? So even if it's a $50 a month tool, if it's something that might be potentially posing a great risk, say, oh, it's just this cheap little tool we're doing, it's only $50 a month. But if it's accessing PHI, we absolutely need to make sure it has the same due diligence that we're providing something like the EHR system. So an example of that was We dealt with a multi-location medical group, and they had BAAs on file for 47 vendors. That's a lot, right? So we just looked at 8 of them, and 3 of those vendors had been replaced by other vendors over the last, I think, year and a half. And the BAA that was on file was for the old vendor. We didn't even have one for the new vendor because everybody just assumed somebody else had been doing the paperwork. There's nobody managing that compliance. Lastly, incident response plans that have never been tested. There's this is basically the same lesson as session 1, kind of repeated, that we talked about here, right? But HIPAA requires an incident response plan, and a lot of them just exist on paper. They may be scheduled a tabletop exercise, but then something came up and it never got rescheduled, right? It doesn't have to take a ton of time. It can be done in 60 minutes. But some of the things that we have to make sure are accurate on those things, and one of the purposes of those tabletop exercises is to make sure that it's correct, it's doable, and we understand how to actually exercise it, how to run it. We want to make sure that all the numbers on there, the vendors, the attorneys, maybe you've got reputation management person on there. Want to make sure that the notification timelines make sense and that the communication templates exist, because one of the first things that happens in a disaster is people panic, right? And we want to make sure that we're communicating the proper way across all of our different methods that we're communicating with folks. And having a template that you can easily copy and paste from can be very, very, very helpful with regards to that. So 60 minutes once a year is not that much of an ask. Yeah.
And Ken, my experience is tabletop exercise are actually one of the most engaging of these, because you quickly learn that who has to report and ask who, and who makes the decision is not known. And it's usually fun because the scenarios are kind of like creative, and it's a super simple and interactive way that'll let you kind of see your own your own issues, if you will, and make them very obvious. So if you've never done a tabletop exercise, that's one of the more fun ways to find gaps and really go, yep, we do need to have a little more structure, a little more ownership, a little more definition of who does what.
And they can even be gamified a bit too. So I'm not sure if you've come across this, Eric, but some friends of mine from Black Hills InfoSec released a product called Backdoors and Breaches. And it's basically a spin on Dungeons and Dragons, but specifically for doing incident response tabletops. And it's more designed for a technical team to be doing for a larger org, but they have some that are less technical focused as well. And it's a great idea. It's a brilliant idea to be able to make it a more fun and engaging experience. So some of the frameworks we see in the field, we've been talking a lot about HIPAA, but the Gramm-Leach-Bliley Act for financial services organizations, or Sarbanes-Oxley for financial controls. FERPA, if you deal with educational records, SOC 2 for service organization trust. And Eric, I think you're aware that we just added an additional SOC 2 domain, right?
Yep.
So which are the ones that we cover now? We've got we just
I think
added.
it's like protection and recovery, and now it's confidentiality. So
yeah, confidentiality is what we just added.
We're starting to see confidentiality kind of bleed into all sorts of frameworks and requirements. And so it used to really just be, are you keeping my data secure, as a general like IT best practice? And now what we're seeing bleed into requirements when, our customers are being done with their due diligence are, well, what's your confidentiality policy and how are you handling it? Which it dovetails into IT, but it's usually like a joint decision between the customer and us. So yeah, confidentiality is a new domain we're experiencing a lot of, and I bet you in 8 years it'll be almost standard care.
I wouldn't be surprised. We've also got PCI, DSS for people that take credit cards and payment card data. We already talked about the New York Department of Financial Services, but we live in the beautiful state of California. I'm not sure if everyone on the call is from California, but we have multiple different aspects that we have to align to from a reporting and compliance standpoint. The CCPA, the CPRA, they've been making changes a lot more quickly than a lot of other states, and there's probably more changes to come too. So again, it's an ongoing sort of thing, and got to have somebody paying attention to the changes that are happening. but each framework is its own work stream, right? Compliance teams oftentimes run each one as if it was its own work stream with different binders, different evidence collections, different review cycles. So what happens is the same controls get implemented and documented 3, 4, 5 times. And auditors are asking the same questions, but just phrased slightly differently. And the teams burn out on maintaining multiple paperwork for the same underlying security work. So the solution there is control mapping, being able to map one set of controls mapped to many different frameworks. This way, we can answer questions once and have 90% of the work done, maybe 80% of the work done, and be able to then show exactly where that maps to on the individual control. So, for example, we have a control of multi-factor authentication on admin access. If you have someone who has documented that process, then they should be able to map to you all the different safeguards that it maps to. So you can save yourself a ton of time and effort. So implement once, document once, map that piece of evidence to all the different frameworks. And of course, you have to QA it, right? But then you're QAing it once instead of re-QAing it in a slightly different way for the exact same control. Now, compliance maturity isn't just a yes or no. It's not a binary. It's not we are or are not compliant necessarily, or at least that's not the best way to look at that. A multi-phased approach, a multi-level approach, is kind of more like a ladder. Most businesses live on levels 1 or 2, where level 1 is just got the document, audits are passing, so we're not at immediate threat of being forced out of our business, right? But the daily practice, it's not really security tied. It's not being managed. It's not being focused. The next level from there is, okay, well, we've checked to make sure the controls are working and the documents are actually being implemented and matching a reality, but we still don't have any higher level management of it on an ongoing way. Level 3 is more, okay, now we actually have a compliance program. It's being fed by security information. It's operationally integrated, and the findings from security are driving the correct investment into which parts of compliance framework we need to focus on. Like Eric said earlier on one of the earlier slides, this is where you really start understanding your compliance and how to allocate those resources. And then finally, a more mature organization is going to see compliance as being a strategic asset to them. So they can take this information. It's going to be an insurance advantage. It's going to be a sales advantage. It's an edge for recruiting top talent. They're understanding exactly how, where, and when they need to be able to spend the time and money to invest. They're protecting themselves. You can brag about this, and it winds up making you look like a much, much better organization than a lot of your competitors. So some concrete moves that will help work with any framework, right? At high level. Do we have a couple questions?
Yeah.
Go for it.
Let's see here. Yeah, I'll get you. So I missed these. Sorry about that. How do you approach explaining to staff the auto lock and security measure? I struggle with being able to get our staff and providers to understand why this needs to be in place. What would be the simplest way to explain the reason to have them buy into policies? Great question.
So the technical reason for the control is because you want to make sure that nobody can come behind the other person and use their desk and steal data or make changes, right? The administrative reason is because it is required by compliance, and if we don't do it, we may go out of business and not have a business for you to complain about. The reality is, ideally, we want to try to find something that isn't going to interrupt the workflow to the point that it makes it untenable to be able to do business, right? The most secure organization in the world would be one where all their computers are locked up in a box in a closet somewhere and nobody's even able to touch them. But then you can't do business, right? So we have to find the right balance there. But there are some aspects of things where we simply have to follow it. And it's just the reality of the industry that we're in. Like, yeah, we got to do multi-factor authentication. You're going to have to punch in a passcode every once in a great while. That's just the reality we live in. And it can be tricky for folks that have been in the industry for a long time. We're humans, right? We get set in our ways. But an ideal a member of the team is going to have a little bit of flexibility there to understand that technology changes, business changes. The way that we do business has to evolve a little bit along with it. What's the next question?
Yep, we have this is another one. We have a vendor that runs IT scans, but CIO implements most things because they manage our IT systems, struggling balancing what information to use from TPX and seeing what's actually in place. What do you suggest is a best approach? I'll try to take this, Ken, and then
Sure.
you tag on. So oftentimes vendors will run scans on a very narrow set of IT, and so the most likely scenario is it's not holistic. They're trying to reduce the risk as it relates to you and their relationship. That's it, not holistic. So usually you need to augment that or use that into an input for a holistic scanning strategy, which tends to bring about external vulnerability and then pretty soon internal vulnerability, and then how you classify risk and take action. So that would fall into a vulnerability management program. And it has probably been used historically as a check the box. We have a vendor that says we do it, therefore we do it. We don't ever have to provide evidence because HIPAA doesn't always make you provide evidence. And it kind of gets back to that slide that Ken was talking about. So what I would suggest specifically is get a meeting with Peter, I think, and Ken, and he can look over that and come up with some real specific ideas once he understands more.
Absolutely.
And did I get that right?
Yeah, no, exactly. I was gonna tie it to some sort of a compliance managed situation, and that you talked about that with the vulnerability management situation.
Yep.
So absolutely. Was there another question?
There's one more that hasn't been asked that was hinted at, but Dave, I don't know if we can unmute you or you can type in your question in the chat.
Okay. I answered it in the comment. You should be good.
All right, cool.
Awesome. Okay. So jumping back into it, some concrete things that we can do, excuse me, that pays off across any compliance program. Making sure that your documentation is version controlled, so we don't accidentally work off of the wrong older version of the document. We know who made the changes. We need to make sure that it's being current and reviewed regularly, not just filed, but actually accessible, searchable, and tied to the specific control evidence. So again, so we can map it out, right? With our technical controls, we got to verify them. I can't just say, yes, we have MFA, I'm checking the box. I have to make sure and check regularly. Yes, I turned on MFA, but did Microsoft run an update and uncheck the box? I have seen that multiple times before where something gets updated with Windows or with Office 365 and they reset a setting. We have to make sure that we're aware and monitoring that. So test the claims. If we can automate the evidence collection even better, then that saves us a lot of hassle, right? And tie the alerts that we're getting specifically to compliance failures, not just security. So both, right? I certainly want a security alert, but when we're trying to prioritize and triage the alerts that we might be getting, understanding that, hey, this one is both a security alert and puts us out of compliance might get a little bit more attention than one that's just a low level security alert. Our metrics, make sure they have named owners for every control area. One person needs to be responsible at some point. You can have multiple people doing the work, but it has to be one person responsible. And a monthly scorecard where they're taking a look and making sure, yes, these things are still being followed, they're being met. These are real metrics. And then an ideally quarterly leadership review where they're taking a look at these things.
And Ken, one of the things, can I talk to that?
Yeah.
When you talk about named owners, we used to struggle with this area a lot. And we started thinking about the world in a RACI model. And a RACI model is RACI. So it's responsible, accountable. So who's responsible, who's accountable, who is consulted with, and who is just informed. And so along any one control, there might be other people who are accountable as input. There might be people who you need to collaborate with, and there might need to be people that you update and inform. But ultimately, it does go to one owner. So I see companies, you don't have to adopt the specific RACI model, but you do have to have an owner, even if there is a path to consult, inform, get approval, and things of that nature on it. And a RACI model is just a real eloquent way of trying to ensure that you understand there has to be accountability, even though other people can be involved in that control.
For sure. Absolutely. Okay, so you want to move forward with elevating your organization. This is an example of what it would look like to do an operational uplift here. Take a month and consolidate things. Make sure we've got one unified control list that we can start focusing on mapping out to different frameworks. One evidence repository, so we don't have stuff for PCI over here, stuff for HIPAA over here, stuff for SOX over here. Maybe reconciling the vendor list against your BA files, right? So that's pretty achievable for a month. Take the next 30 days, might need to be a little bit longer, but next 30 days to pick the top 3 controls and start testing them. Make sure that it's not just on paper, that you've actually validated them, and document any gaps in remediation. Then the last 30 days, make sure you've got your named owner, just like Eric was talking about with your RACI sheet there, that you've got some sort of review cadence in place and that there's a quarterly leadership scorecard. Now, CIO can help with this, whether you're a new client, existing client, either way. If you have a compliance framework or multiple compliance frameworks, we can now do compliance as a service where we will handle all of that heavy lifting for you. We will manage all of your policies throughout the entire life cycle. We will keep your risk register alive, focus on your vendor and VA discipline, manage your IR plans, do all the framework mapping, do the quarterly meetings, the monthly meetings, run these different things, be involved with your auditors. This stuff is getting handled currently piecemeal by most clients at the moment, where they reach out and say, hey, can you take a look at this policy? Hey, can you remediate this one thing? But there is nobody who's actively managing it as an ongoing service, an ongoing process. So if you're interested in this, absolutely reach out to your account manager, to your CIO. If you're not a current client, reach out, and we will be more than happy to chat with you about it. So key takeaways here: compliance is a floor, not a ceiling. We want to make sure that you're passing the audit and building a real actionable program to make sure that what we have in practice is actually keeping you safe.
And Ken, we're just about over on our time. You can keep going. I just want to, yeah. Oh, good. Okay. Never mind. Go ahead, Ken.
Okay. So yeah, we want to make sure that the policy is actually being practiced. It's actually matching what's being done in reality, and that multiple frameworks doesn't necessarily mean you have to run multiple programs. If we're mapping everything, then you have measured twice and cut once, right? So feel free to reach out and book a compliance review with us. I think we answered a lot of the questions. That's pretty much it.
All right. Thanks, guys.
All right. Have a great day, folks.